This is Lily Cotilla. Welcome to Edging Life. Actually, therapeutic-based tips to help you live fully in life. This topic is a little bit offbeat, but I'm going to put it out there because it affects families and children in the long run. There are many different theories about pacifiers and sucking thumbs and when to make a child stop and how reliant a child should be on a binky or whatever you want to call it emotionally for nurturing for whatever length of time. People like to debate about this topic and or judge and or behind the scenes, the women get together and talk behind backs of who's doing what and whose kids where and what and up and down and blah blah blah. Anyway, from a scientific standpoint, it is really highly recommended that a child be allowed to suck his thumb or her thumb for the period of time that he or she feels she needs to. You will be able to notice a difference when it gets to the point where it's more of a behavioral habit. But from a scientific standpoint, the sucking of the thumb pulls down the vomer bone developmentally. It pulls it more toward the tongue, the vomer bone being the palate. And in terms of speech and where the tongue hits the vomer bone, and also in terms of cranial pressure, the baby is not just doing this, or the young infant, for suckling as if it were a nipple or for comforting purposes. He or she is actually doing it biologically to shift the inner relationship of a vomer bone to nasal cavity to cranial structure. So keep that in mind next time you try and stop a child from sucking his thumb, because he is naturally taking care of the proper positioning of bone structure for talking, for decreasing headaches, for many different things. It's not just about attachment theory and self-soothing. Okay? Do what you want with that. Bye.